Hi, today I wanted to shine some light on one of the most exciting and ethically challenging frontiers of mental health, BCIs, or brain-computer interfaces. These are devices that allow direct communication between the brain and the machines, and they're showing some real promise in treating psychiatric conditions like schizophrenia and depression. And with that promise comes important questions such as autonomy, important consent issues, and privacies. So, before we explore the innovation that can sometimes conflict with free will, let me tell you a little bit about myself. I'm Amarthya Shree Nagendrapandian, and I'm currently a rising senior at West Windsor Plainsboro High School South, located in Princeton, New Jersey. And I'm passionate about public health and health equity. I have done research at Columbia University Mailman School of Public Health, Pfizer, and NJIT. I'm proudly the founder of EquiCare Connect, which is a digital health equity and telemedicine organization. I'm also a member of Stanford Neuroscience Journal Club and the president of Neuroscience and HOSA at my school. I'm also the lead biomedical researcher at Money Health, which is a wearable tech startup, and I'm also deeply rooted in culture as I am a Tamil school teacher and event coordinator. So, what is BCI? BCI, or brain computer interfaces, is a system that enables direct communication between the brain and an external device by bypassing traditional pathways like muscles and speech. BCIs detect electrical signals in the brain via EEG or implanted electrodes. And they interpret them using algorithms and convert them into digital commands, allowing users to control prosthetics, software, and even brain activity. Originally developed for motor rehabilitation and assistive technology, BCIs are now explored in psychiatric use, such as managing depression, OCD, and schizophrenia. So let me tell you a little bit about the background and introduction. Mental health disorders represent one of the most pressing public health challenges of our time. This escalating prevalence of psychiatric conditions like depression and schizophrenia affects over 970 million people worldwide, creating a significant healthcare burden on the healthcare system globally. Despite the massive scale, access to effective mental health remains deeply unequal, leaving millions without inadequate treatment options. BCIs, which facilitate these direct communication between brain and the external devices, have emerged as promising tools to address these treatment gaps. This technology offers therapeutic potential specifically for depression and schizophrenia, which enables direct interaction with neural circuits involved in these disorders. However, the potential for BCIs to influence neurological pathways raises significant ethical concerns, particularly around patient autonomy, informed consent, and privacy. The ability to directly access and potentially modify brain activity creates unprecedented ethical conditions that medical community has never faced before. The ethical complexity becomes particularly pronounced when considering psychiatric patients may have compromised decision-making capacity. Furthermore, BCI generates intimate neural data that reveals not just medical information, but potentially thoughts, emotions, and behavioral patterns, raising critical conditions and questions about the data control and protection. This presentation aims to examine the ethical complexities around BCI use in psychiatry, specifically focusing on the balance of technological innovation with patient autonomy and safeguarding free will. This is done through examining recent literature on BCI implications in psychiatric care, providing both identifying both the therapeutic potential and the limitations of the existing regulatory frameworks to manage ethical risks effectively. Methodology. To assess these concerns, I conducted a comprehensive review of recent literature that was carried out as per PRISMA guidelines, primarily through PubMed, utilizing a appropriate mesh terminology to examine the utility of BCIs in psychiatric conditions such as depression and schizophrenia. So the initial search for BCI in psychiatric morbidities included the following words of brain-computer interface, brain-machine interface, machine-brain interface, etc. In psychiatric words, it was mental health disorder, mental illness, psychiatric disorders, or severe disorders. And the mesh words for ethics were clinical ethics, policy, justice, issues, natural law, and policy morals. Following our initial screening of 58 records published between 2010 and 2024, 23 papers met the inclusion criteria that were included in our presentation and subsequently analyzed for key insights on patient outcomes, present scope and future potential of BCI technology, as well as the current unaddressed research gaps and ethical considerations that may impede in effective implementation. Additionally, quantitative measures of BCI effectiveness were evaluated in terms of symptom reduction and quality of life. Similarly, our initial screening of 473,772 ethic records published between 2010 and 2024, 125 papers met the inclusion criteria that were included in our presentation. These studies were subsequently analyzed for key insights related to ethical considerations in the implementation of BCI technology, focusing on themes such as potential impact on patient autonomy, informed consent processes, privacy concerns, and equitable access to treatment. The results. The current literature posits that in a smaller amount of cohorts of psychiatric patients, BCI demonstrated an average 35% reduction rate in depressive symptoms and a 40% subjective improvement in cognitive functioning for schizophrenic patients. However, only 20% of these studies were found to address long-term ethical risks. Substantial gaps were recognized in current regulatory frameworks surrounding the use of BCI to ensure equitable access that safeguards the patient's autonomy, particularly in populations with diminished capacity to provide consent. These findings indicate that while BCI shows promise in providing symptomatic improvements, ethical considerations, specifically regarding autonomy and informed consent, still remain unexplored. Solutions and future directives. I believe that the current body of literature lacks a comprehensive exploration of ethical implementations of BCI and the routine psychiatric practice, specifically pertaining to the patient autonomy. I advocate for establishing a universal regulatory framework alongside specialized ethical training for all stakeholders before the large-scale implementation of BCIs to ensure effective evidence-based care. Call to action. As emerging leaders in global public health and digital equity, we must ensure that the rapid innovation never outspaces ethical responsibility. Like I mentioned before, I am the founder of Equity Care Connect, and here we develop telemedicine tools following ethical guidelines provided in the new regulatory frameworks mentioned, and connect underserved patients with affordable health care providers, ensuring equitable access without compromising dignity. These are my resources. I would like to acknowledge my family, my professor, Dr. Belsky at Columbia University, my mentors, Jappy G. Parmer and Ashwath A. Pillai, and the Global Health Leaders Conference, and of course, you, the listener. Thank you so much for listening. Feel free to contact me at the provided LinkedIn and email contacts. Thank you.